So we'll keep your great intervention for yourself, Robin. No one will ever get to see it. So, Andriy, do you want to take the floor for perhaps 5 minutes so that we can have a bit of a question and answer before we move on to the Stop TB board meeting?
Yeah, thank you so much. And thank you, Robin, for your comprehensive overview. So I fully support your analysis and highlights of the meeting. So few additional things. One is being Ukrainian and being based in Ukraine. I am so appreciative to the solidarity and support from the Global Fund, which also the board leadership, which gave me opportunity to speak at the beginning. So I would not go to the details, but I would share later the highlights of the lessons from Russian war against Ukraine, and it's affecting huge population. Just to mention, only in the territories affected by the war, over 100,000 people with HIV are used to live. In terms of the board decisions and highlights, I fully agree that the replenishment is a key priority and a major priority for the next 4 months. As GFAN and overall civil society and community, we are doing the great job, but we need to do more. We discuss also the competing priorities, in particularly even Russian war in Ukraine is also driving a lot of attention and resources, as well as COVID-19 and other pandemics. So we should approach this creatively, turning competitive priorities into mutual support and showing Global Fund role in this, especially from community and civil society perspective. As for CRG, we again and again flagging that this should be part of the main agenda, not the side meeting, not the pre-meeting. So we hope for the next meeting it will be incorporated into the main agenda. For the strategy implementation, it's a key point, and we agreed that it should be translated, the key priorities, communities in the center reflected in the strategic framework and the narrative to be translated into action through the strategy implementation. So it's well, the difficulty is that this is at the border between board decision and secretariat decision. So there is no well, there should be more practical steps elaborated or agreed or communicated by the secretariat how they would ensure strategy implementation. As for the catalytic investment, just to flag that the decision has reference to different scenario, and scenario with underfunded Global Fund with a range of 12-13 billion will be a disaster. So all achievements made with the catalytic investments will be turned to zeros. If you look at the table, which is a part of the official decision, for majority of the lines it's 0, 0, 0, 0 or peanuts. So this is a very dangerous scenario. We should all work together to mitigate, thus to ensure better replenishment outcomes. Well, for us also, it's important to highlight that for allocation methodology, we're also not fully happy with GNI per capita because it rather reflects the country situations and people situation. And this is the people we are aiming to work. The lives, 20 million lives, it's the lives of people, not country, not so that's why it's important to have measurement according to our major targets. So for the sake of time, I would stop here and rather will keep remaining time for answering questions or comments. Thank you, Ola.
Thank you so much, Andriy. I don't think we have anyone of the communities delegation on the call, so I think I'll just open the floor for questions. I really want to say that it was really inspiring to hear you speak, Andriy, on the effects of the attack and the war against Ukraine by Russia. So it was, yeah, I think they really said, I think, an important tone for the whole board. On this, I want to open the floor for questions to any of the board members that are present on the call. Is there anyone with any pressing comments? No. I don't see anyone. There's no one on the. There's no one in the chat either. Well, so then we have another 10 minutes. If you, so I know I have told both of you to be short, and you were really good. If there is anything you want to add, sorry, there's a question from A. It's good because I was about to bring catalytic investment. So can we explain again what happened for the zero on every line for catalytic investment?
Yes, let me.
So if you want, I can set the scene, Andriy. So, and what Andriy was referring to is the way catalytic investment was presented to the board was in the form of a table corresponding to various level of funding, and so different amounts were attributed to catalytic investment depending on how much money was going to be raised during the seventh replenishment. So the more money was going for the seventh replenishment, the more money will go to catalytic investment. And catalytic investment is cut faster than other items, meaning that once you drop to 13 to $12 billion for seventh replenishment, essentially catalytic investment disappears. Like very little money goes to catalytic investment at all, which is really worrying. We also have a question on GNI per capita. Which of you wants to take it? What does that refer to is the question.
Andriy, do you want to kick it off?
Yeah, I can do. So in addition to what Quentin said, just to mention that many lines are disappearing from funding. So like for multi-country grants, there will be zero. And for now, multi-country grants is the only possibility for non-eligible countries still to get involved in some multi-country or regional activities. Another example is that for innovation and scale up of HIV prevention, it's also zero. TB, well, I mean, this table is not a secret and we need to share it at some point. So it's really a concerning scenario, but this is not an inevitable scenario. This is a scenario with a low funding. So that's why kind of the message is to oppose to this. It's too late to oppose the paper, but it's not late to make sure that Global Fund will be fully funded. As for GNI per capita, it's like a gross domestic product divided by population. So this is a category which used by the World Bank for the classification of countries, like low income countries, middle income countries, etc. But we especially, our delegation reached out to the Global Fund to the World Bank several years ago, checking would it be the parameters they would recommend to measure funding possibility within the Global Fund framework. And their response was, no, that's the indicators they developed for their own purpose. So it was designed for a bit different purpose, for measuring just economic capacities of the countries. But when we are talking about response, and we have several examples where GNI is relatively high, but in terms of key populations accessing services, they're minimal. They have minimal access. They're poor. So it doesn't reflect any stratification or gaps between poor and rich. That's the problem. So it's purely mathematical indicator. So that's kind of the message, that this could be left, but it's also should be complemented by other measurement of economic capacity, not only of countries, but its citizens, including marginalized one. Thank you. Yeah, Robin, over to you.
Andriy, you should be a professor. That was so clear. Thank you. I have nothing to add.
Thanks, thanks a lot, Andriy. Thanks a lot, Robin. Okay, so I think we've covered all the questions that were in the chat. Is there, just to say that I saw a few comments. So I saw that Catherine, you shared a link where you can see, everyone can see that that table that we were referring to with regard to catalytic investment. You can also get an idea for the high funding scenario, where the money will go and which, what is being prioritized within through catalytic investment. Just to note that we'll be releasing a report of the GFAN report for the board meeting, which should be coming out hopefully by the end of this week, where you will get to see some more details on all of these questions, including some of the slides. Is there any other questions for either Robin or Andriy? If there isn't, Sophie, please go ahead.
Hi, thanks so much for the update. We had heard that at the board meeting, there was also a bit of a split in terms of delegations, not the communities, but talking other delegations that were not supportive of key populations, gender equality, human rights were being supported through their catalytic investments to a larger degree. Could you talk about that, if there was a split on the actual board, and if there is a strategy to kind of deal with that or address that? Thanks.
Hi, Sophie. Andriy, are you okay if I take the first stab at that?
Yes, please.
Okay, super. And I apologize for the background noise. I'm just on my way to drop off kids at school. So I'm on the road. So I wouldn't necessarily say that there was a split, although that could be perceived as such. I mean, these are really difficult conversations, particularly when it was laid out with those three really undesirable scenarios, right? From the worst case to just an 18 billion. We all know that at an 18 billion replenishment outcome, we're still going to have extremely difficult allocation decisions to make with difficult trade-offs. And so I wouldn't say it was a split necessarily, but it really came down to a couple of things. First, around the prioritization of RSSH within catalytic investments. Secondly, it all of a sudden became almost as if next-gen market shaping under catalytic investments was pitted against human rights and key populations, because those were the elements where the biggest changes were seen in terms of percentage increases and decreases. Of course, we can't say one without the other. We need both, right? In particular, the next gen market shaping piece was really looking at ensuring that new innovations get to key populations the fastest that they can possibly get, particularly with malaria and the newly emerging resistance, particularly in Africa. So I don't think that they were pitted. These were just very difficult conversations amongst a number of, well, all of our constituencies that have sympathy and empathy and want everything to be included. But human rights, key populations, community and gender, this is what we've been fighting for. And it is the backbone, as I said, of the next strategy. And if it's not funded and it's not seen as being core to the next strategy implementation, it's not going to work. So again, those conversations are ongoing. And I think it was just emblematic of the difficult environment that we currently are in. And even at an $18 billion replenishment, we're still going to have many of these difficult conversations. Thanks, over. Sophie, I hope I helped to answer that.
Thanks a lot, Robin. Andriy, do you want to add something?
Yes, I also would not characterize the situation as a split and would not discuss position of individual delegations. I think we still have this consolidated approach with communities in the center of the new strategy, with human rights and gender equality and equity to be prioritized more than with existing strategy. So the point is how to make it a reality. And catalytic funding is one channel, but it's only in the best scenario, it's only 1.1 billion out of 18 billion. So let's not to forget about these major country allocations, which shouldn't be excluding the priorities we have agreed. Yeah, so in reality, it should be more. And I think there are some constructive solutions. And also from the donor side, I don't feel any split between communities or civil society delegations and all major donors. So we are at one side, we are on the right side, on the correct side, I mean.
Thanks a lot, Andriy. Thanks a lot, Robin. Thanks a lot to both of you.
Sorry,
yes,
Quentin, just to re-emphasize Andrey's point, right? So we are all coming at it from the same perspective, right? And it's difficult conversations, but Andriy is absolutely right. And this point was clearly made by Carolyn as strategy committee chair, that we really also need to be focusing all of our efforts to ensure that country allocations reflect all of these different step changes. And it's not just within catalytic investments. So we do have a lot of work to do in front of us, and especially for the July committee meetings and up to and beyond the November or the September replenishment. But absolutely agree with what Andriy was saying. Thanks.
Thanks a lot, Robin. And I'm sorry, but I think we do have to move on to Stop TB. Okay, I see what you. So I apologize, but we have a second board meeting to hear about. So thanks a lot to Andrew and Robin. Sorry that we have to cut this conversation a bit short. There's a lot happening, and so I will want to quickly move on to the Stop TB board meeting, which took place last week. And I saw on the call that we had a few of so I see Austin is there, Carol is there. Carol, do you wanna perhaps take the floor first and set the scene a little bit about what were some of the key issues that were covered during the board meeting and some of the key moments?
Okay, thank you, Quentin. But I was hoping Austin would start because I missed most of Friday. So I don't know, Austin, I know you are the new vice chair, but maybe you could start. But I'm seeing that we have Peter on the line as well, who's the other board member for communities. So Austin, if you could start, then I can come in with the more focused community kind of points.
Perfect. Then let's do that. Austin, do you want to?
Okay. Thank you, Quentin. I thought, I mean, I didn't want to be a little bit biased because being the vice chair, somehow I am supposed to be a little bit speaking broader than narrowing myself to communities. But the good
No,
thing
no, no.
is that
I'll speak. Sorry, Austin. I'll do communities. You can speak broader. Then I'll come in with
okay.
community. Yeah.
Okay. Okay. So okay. Thank you. So we had excellent 2-day hybrid Stop TB partnership meeting, and the focus we are mainly around the G20 support, because it's the first time that we having TB on the agenda of G20, and also speaking broadly also around supporting the replenishment of the Global Fund, which I mean, the communities also have their own side of campaign that happened alongside the replenishment support. Another thing was around I didn't know you were going to put me on the spot though, so but that's fine. Let me another discussion that we had was around how to close the gap, because we know that with the Global Fund, it's not supporting everything in TB now. Looking at the global, the launch, yes, okay. The highlight again was also the launch of the global plan to stop TB. So the global plan was actually presented at the meeting, and the main highlights were around how to get resources to be able to, I'm trying to get some of our decision points around. Okay, I don't have that, but I mean, so some of the highlights were around how to support some and other mechanism on how to get resources into the Stop TB, not just the Stop TB, for the countries to be able to get resources to implement alongside the targets of the high-level meeting. Another highlights were mainly on also the high-level meeting for 2023. There'll be TB high-level meeting for 2023, and the planning have already started in a way because the partnership and the WHO are now looking at the facilitators in terms of countries, and also communication have gone to the President of the General Assembly on a possible time that the spot, because it usually happens in June or in September. So, but the partnership and also the WHO is insisting that it should happen in September. That is when the heads of states does attend the meeting, so that we can get high-level meeting, high-level participation in terms of commitment. Then the partnership also discussed mainly around, like I said, around the supporting the replenishment of the Global Fund, which we know that if we're able to realize the 18 billion and over, TB most likely get more resources, knowing the gap that we have in tuberculosis. We discussed Ukraine as well because of the support that is going to Ukraine, and also trying to see how we can get more support to people who are missing in terms of treatment, and also the refugees who are also now moving into the neighboring countries. So we had a discussion around how we can be able to support, especially TB clients who are on treatment, who are not getting the care they're supposed to get as a whole. So these are mainly the highlights. The G20 that discussion was good, looking at the fact that Indonesia and India are really highlighting a lot on TB. This is the first time it's happening ever within the G20. TB has never been mentioned at G20 meeting. So it's quite good. We discussed, I'm sure you know about the challenge facility for civil society. We also discussed, because that's only one main big mechanism where resources are actually trickles down to communities, to do real community activities at the lowest level. So we had quite a good discussion around it and how other donors, bilateral donors mainly, can support the challenge facility. At the moment, we have USAID and also Global Fund supporting the mechanism. So we had that that discussion around the table. Then the discussion is actually now around not just looking at TB per se, but also doing integrated service delivery, looking at other diseases as well. So, and also other components like nutrition and all that. So it's not just looking at TB as a disease. So I will leave it here. Probably Peter can add more, or Carol can add more. Thank you.
Thanks a lot, Austin. So we only have 15 more minutes. So I see that Delinia is on the call. I saw that Peter was on the call and Carol's on the call.
Carol, you want to go in first?
Yeah, I can just go in quickly, just to
go ahead.
Just add on to what then Peter can come in. Yeah. So I think before the meeting actually started, we even had come up with a community and NGO delegation statement in advance of the board meeting. And this had a lot of priorities, which included, I think, like Austin said, the UNHLM. We wanted to make sure that there could be a community advisory panel in advance before that, and other issues around the challenge facility and the daily divide report. But the other areas we looked at was the global plan to NTB 2023-2030, which is sort of being developed. We looked at the 250 billion figure that is in it, how to get around that. The other one we talked about, again, is around the disease split. We are pushing as communities and civil society to ensure that 33% comes to TB, because in most cases, the Global Fund gives less to TB. On the UNHLM targets and commitments, we noticed that from the time when we did our daily divide report and the commitments, we noticed that the realities and commitments are even, getting worse. So the lack of these targets and commitments, including the ones on community human rights, and many countries had not yet completed their TB-CRG assessments and plans. So we talked about that a lot. The other one was an impact that COVID has made, but also the mitigation and the impact that has been seen in countries due to the investments. As most of us know, in the time of COVID, a lot of resources were taken away from TB to support COVID. So we lost a lot from that, but then we are looking at also leveraging on that. The challenge facility, as Austin has said, is the only mechanism that is supporting civil society directly. So we pushed to have more donors put money in that. There was a particular focus on national level advocacy efforts from Nigeria, Indonesia, and Ukraine. We talked a bit around that. And also the importance of securing more funding for TB Reach, which is also another mechanism which is supporting. And then we talked in the role of Canada, UK, and US, which is in the current round. The deadly divide report that we had written, we are looking to having another one, which should start soon to be completed in time for the UNHL meeting in 2023. Also, there was, like, again, Austin said, a lot of a session dedicated to Ukraine about people affected by TB. And I just wanted to emphasize that for us, there was a good intervention from Olia, from TB People Ukraine, and the Stop TB Ukraine. That was a strong demonstration from that. So maybe I can pass on to Peter to quickly add in a few things.
Thank you a lot,
Yeah,
Caro.
thank you.
Peter?
Thank you, Caro. I'll take only 2 minutes. Thank you very much. Caro and Austin have said most of the things. I just wanted to emphasize the issue that that TB has very little funding, and the impact of COVID on TB was much higher than any other disease. But that notwithstanding, we were looking at how we can leverage on other bilateral donors, and we identified some countries like France, Norway, and others who can help support the TB fund. As she has mentioned about CRG, which is a very global fund has been supporting, but the coverage is very little, and we look forward to more funding across the 3 pillars on the assessment of community, gender, and rights across the board, particularly in high burden countries. We also pinpointed on other specific funds that has already been mentioned, but mostly we want to hear more of the community voices in the global fund replenishment, and we look forward in September, wherever it will be in the US, that we want more communities to be there to plead with the donors to give support to the global fund, because anything above 12 billion US dollars and above 18 really will enhance the percentage of TB in the replenishment. Thank you very much.
Thanks a lot, Peter. And thanks a lot to all 3 of you for that summary. Delinia, I see that you're on the call as well. I know you might have internet problems, but do you think you'll be able to jump in as well?
Certainly, and just we've had a wonderful review from everyone who spoke before me. So just wanting to emphasize that I think that there was a true appreciation of the importance of having effective voices, and the decision about board composition coming before the board to say that there needed to be at least 50% representation from communities. And so that is an action for restructuring that the board will be taking. I think the discussion around replenishment was huge, but also with a side statement that new donors and even existing donors needed to consider stepping forward to do some TB support outside of that particular mechanism. Certainly a focus on the challenge facility was enormous, as my colleagues stated. Getting to see the global plan and having Paula Fujiwara walk us through its design. She was one of the coordinators of the whole process, was very important. And simultaneously then there was the launch of the 2nd iteration of the language guide from Stop TB Partnership. This version is titled Words Matter, so it's now available electronically. Some hard copies were distributed, but the encouragement then for everyone as they move forward in their advocacy and in their writing, that they look to the guide with real attention to the community rights and gender issues, with true sensitivity and understanding the impact of words. I think that we had a beautiful intervention discussing Ukraine and the response and the stamina and resilience of Ukraine itself, and then the actions taken by countries nearby, Moldova and Romania, which was really very moving to see and hear. I think there was a review also of the UN Ops is having some internal issues and wanted to bring it forward so that the board knew that there would be action taken to rectify any concerns that were raised, but it would have no impact on Stop TB. The discussion that the next board meeting will then be in India at the invitation of the Minister of Health. And I think that, you know, the more of it was an internal sort of, had been an independent review of some of the practices within the partnership. And I think the alignment of the organization in trying to make sure that their operating procedures are appropriately addressed. And I believe that that would be what I would want to add to what my colleagues have already offered.
Thanks a lot, Delinia. I see that we have the same document being shared twice in the chat by Selam and Kelly, so thank you both. Is there any questions for on the Stop TB board meeting that anyone wants to put forward? You can put it in the chat, or you can just raise your hand, or just turn on your camera and I'm going to call on you.
Quentin, I just wanted to add that Stop TB Partnership board documents are on the website, on the Stop TB Partnership website. Anyone can access it. It's meant for the public.
Thanks, thanks, Dustin. I think this is the link that was shared by Selam and Kelly. So yeah, so all the documents are public. You can all go and have a look. If there are no questions yet, if there are questions, put them in the chat. But since we have a minute, I want to invite Peter, which has made it to the call. Peter, are you still here?
Yes, yes, yes. I'm
Hi,
there.
Peter.
So sorry for being late. We just were preparing something, and I got just a communication with the ambassador of Rwanda for a high-level event. So he just confirmed. So we're very excited, and I missed the deadline. I'm sorry for that. But you heard that that Germany sort of announced the 1.2 billion, which is of course more than the 630 million that were in the budget. So we are a bit happy about that, but we are not overly happy because the fair pledge or the fair share amount of Germany for the Global Fund would be 1.8 billion and not 1.2. And if we argue with the 30% increase that we all need in order to make the replenishment a sort of a success, the 1.2 billion represent only 20%. So there's a long way to go. And in any of your communication, I really urge you not to applaud too much to the German government. So there's a long way to go. This is not the fair share that we expect. And for the time being, we are not overly happy about about the announcement. But of course, it's better than nothing. So thanks. I don't have anything more to say. Most of us will see one another next week.
Thanks. Thanks, Peter. I think what's important to understand on the so first, I think what's something that's important to understand about those pledges is that for every major donor that pledges less than the 30% increase in the sixth replenishment, that means someone else needs to make up for that difference. And worse than that, if the difference is not made, the pledge, because the pledge in the US is conditional to all the other countries making a total of 12 billion of pledge, it compounds, meaning for every $2 you lose on the pledge from a country, you also lose $1 out of the US. So it's even more important that for every country, especially the ones that announce early and pledge early, like Germany, not to let them set the tone that 20% is okay, because if we get 20% about if we get 20% from every other major country, we're not going to make it at all to 18. So it's very worrying. I see there's a few comments in the chat, Peter, asking for guidance on how to pressure the German government, expressing support for the work of advocates.
Well, I mean, you're here next week, and we will have some public events where you can raise your voice. So there will be this demonstration in the die-in in front of the Chancellery. So we are sort of making a lot of noise, and I really urge you to come out with your expectations towards our government. So we are going to record to publish that. You can help a lot, and of course you make a difference. So all of it is involving, of course. We hope for the G7 meeting and the G7 summit. Germany claims to be a global health champion. What we see so far is nothing that deserves that title. So it's upon you to be outraged like we are, and be it as polite as possible, but as direct as possible.
I like the politely outraged formula that captures it well. And I see Chris Collins, Friends US, putting in the chat that we're preparing a visual along the idea of don't leave US money on the table. And I think it's very, very important for everyone to understand that because a third of those 18 billion is meant to come out of the US, but the US will not provide more than a third of the total. The more, the less money we have, the less money we have, which is really a challenge. So as Peter mentioned, there will be a demonstration in parallel to the GFAN meeting that will take place next week. We will be putting out this week a social media guide to help anyone who's not in Berlin next week to help us online to make sure that we are heard. We're going to go in front of the Chancellery and try to hand over the open letter that many of you signed. In that you still have a day to sign it, so it's not too late. I will be putting the link in the chat. But so if you can help us online by making noise, it might force the Chancellery to read our letter, to pay more attention to us, as we will be exactly under their window. So wait out for that. So if you haven't yet signed the open letter, you can find it on our website. I will put the link now. I see a question from Anne-Marie about the G7 communique. Do we already have a language, Peter?
I'm afraid I don't understand the question. What I mean, we have to communicate. It's in English, so that's the language. What do you want to know? Sorry, I'm not a native speaker.
Sorry, the content, the language about the global fund that was hoping to be included in the G7 communique. Thanks, over.
Yeah, I would love to know that. No, we don't know. I mean, we have to C7, of course, communicate. There's a strong language, but this is ours, of course. No, we don't know that. We hope we keep the fingers crossed. And sorry for my stupid question.
It's no stupid question. It's a safe space, Peter. We'll take a break. So we are almost on the hour. If there is any lingering question to any of our speakers, raise them now. But meanwhile, unless any come up, I really want to thank all the board members from the Global Fund, board members from Stop TB for joining us on the call. It's some of this conversation can be a bit technical when you don't follow them from up close, and I think it's particularly important to hear your come back to us and sort of put it out in layman's term to make clear what has happened, what happened behind closed doors that we might not have a chance to see, what do all these decisions mean, etc. So thanks a lot to all of you. There's a lot happening. Some of you will be in Berlin next week. We're looking forward to see you there. Yes, with all of this, I will be ending the call. Thank you all for joining us. There will be no GFAN call next week, so the next one will be on June 8th, 7th, 8th, on the Wednesday, first week of June. And it will be an update on the replenishment campaign by the Global Fund Secretariat. So we hope to see many of you there as well. Thank you all. Have a great end of your afternoon, day, evening, night.
Yeah. Thank you very much.
Thank
Bye,
you.
everyone.
Bye.
Thanks, everybody.
Bye.
Thank you.
Bye.
Bye-bye.
Bye.
Thanks, Robin. Thanks, Peter, for joining.
Miriam,